let's talk about back pain today a little bit. So most back pain is usually non-specific low back pain, which means that there's really no cause, at least no one singular cause. Where we go wrong a lot of times is we have these initial insults, or we injure our back doing something, lifting groceries out of the car, picking up our kid, even bending and twisting the wrong way just while brushing our teeth and going to spit out some water. And then we tend to perseverate. We tend to hyper focus on these symptoms over the course of the next few days. It's pretty typical to feel soreness and pain, discomfort after initial injury, but that should taper. And normally it does, except for when it doesn't, right? And that's usually because we're thinking about it. We've got these belief systems in our head that pain equals damage, and unfortunately that's just not true. We've been taught from early ages to be fearful of the spine. Don't bend, don't twist, definitely don't do the two at the same time, otherwise you're going to blow out that jelly donut that we call the disc in our back. Unfortunately, it's just not true. Our bodies are way stronger than that. We're robust. If the body was that weak, there would be no such thing as contact sports, especially for little kids, right? Little children who, they're already much more squishy, much more malleable than us because their bones aren't fully formed. They don't have all that, soft tissue mass restricting joints from movement and everything. So just take that for what it's worth. In the long run, back pain is, one of the most over-medicated, over-prescribed treatments that we have in the US. We tend to go to the physicians first. They tell us, here's some painkillers. It's it's probably some degeneration or some kind of, slipped disc, if you will, which is not a real thing. Discs don't slip, degeneration is normal. So unfortunately, those pictures that we normally get, MRIs, X-rays, they tend to only make us more fearful and more scared, because now we've got this confirmation that our back has decided to degenerate on us. However, that's a normal part of life. And then that matches the pain. So there's the picture, there's the reason why, and now we've got this doctor, some authority figure telling us that your back is as bad as they get. You're 35 years old, but you've got the back of a 65-year-old. Be careful, if you step off a curb wrong, you're going to be paralyzed. And that's simply false narrative as well. It's fear-mongering at the best, and it's self-limiting those patients at the worst. So we'd love to see you here at Movement Theory. If that sounds like something you've been told, or you've had that kind of experience, you've had other physical therapists, and nothing really has helped you, we would love to give it a try. We know you're hesitant. That's why we offer a free discovery visit. No cost to you. Come in, we'll talk about things you've done in the past. We'll talk about things that you might be doing in your daily life that's keeping your symptoms aggravated. We'll talk about things you can do beyond our free resources to help bring you some relief and help you live the life that you want to live.